We're excited to announce that our podcast, The Table with Renee Da Silva, is evolving. We're introducing 3 new streams of content on this podcast, designed for Health System CXOs and hosted by the Health Management Academy's subject matter experts for health system nurse executives, health equity officers, and strategy executives. With this change, we'll be activating health system leaders towards outcomes and scalable solutions you can implement now. Welcome to the Health System CXO podcast, featuring 3 streams of content designed for health system nurse executives, health equity officers, and strategy executives. I'm Jasmaine McClain, Executive Director at the Health Management Academy and Health Equity Officers host. And together we'll explore equity in plain language and assist you as you navigate the complex structural challenges associated with system transformation and health disparities. Welcome to the Health System CXO podcast. Rachel, I'd love to start by getting to know a bit about your journey as a healthcare executive to where you are today with Nemours Children's. You're a pediatrician by background and have held a number of healthcare leadership roles prior to Nemours at Johns Hopkins and the U.S. Department of Housing and Urban Development. As a pediatric health system, multiple leaders across Nemours have been vocal about the importance of health equity and the desire to be bold in driving change. So how do you think about honoring both the legacy and the successful roots of your organization while also pushing for excellence in a new gear?
Well, Jasmine, it's so great to be with you. Thanks for the invitation and the opportunity for the conversation. You're right. I've been in a variety of different environments, but I think the North Star for me is always my work as a pediatrician. I'm a general pediatrician by background who's been clinically active for most of my career to date, seeing patients at least weekly. And, I'm always reminded of what they're facing in trying to ensure their kids get access to health equity, which is, the optimal health for that child, that family, and that community. And that's something that applies to every patient I see, every community I've worked in. And I think what really inspires me about being part of Nemours is the way that as an organization in a multi-state children's health system, from the very top of the organization, that focus on health equity just permeates everything we do from our CEO on down. And we also take really seriously through the work, advocacy work in our National Office of Policy and Prevention, our role as a voice for children all across the country, even beyond our service areas, to advocate for those programs, whether it's within healthcare or whether it's in other areas that really impact children's health, like nutrition and early childhood and early literacy, to advocate for policies and programs that are going to support well-being. And so it's just such an exciting place to work. I've been in a lot of integrated adult children's health systems where a lot of times we're really focused on those Medicare populations, those adult populations, and it's hard to make that same return on investment case within healthcare for kids, even though we know that the return on investment in our children, who represent 100% of the future of our society, when it comes to like a broad societal point of view, they are a really, phenomenal investment, and investing in their health is something that I think is near and dear to most of us, whether we're parents and caregivers, whether we're community members, and certainly I think the calling to serve children is one of those things that really unifies every person who works at Nemours Children's Health.
Yeah, I love that. I know that your perspective as an individual has been so inspiring and, really a role model for other executives, but also the work across Nemours, and I know we're going to talk about that a little bit, has been a model for other health systems across the country. Are there experiences or successes in your work that you're most proud of that you would highlight?
Well, I'm one of those people who always feels a little awkward taking credit for work that's happening across the system, because it really doesn't happen without teams. And so I have to shout out the IDEA team. That's the team that really supports our health equity work within my direct leadership purview, but really also so many other partners and stakeholders, whether it's quality safety, whether it's our nursing leadership or our value teams, our physician leadership, our primary care leadership. There are so many folks across the organization that really have come together to partner with us as we've built out an equity strategy for the organization over the past 2.5, almost 3 years now. And there's three things I just want to highlight. They're kind of different flavors, but three ways that I'm really proud of what we've been able to accomplish and bring to fruition this year. The first is we were excited to be invited by Independence Blue Cross to be part of a regional coalition to eliminate race-based medicine based in our Delaware Valley geography, and have really been a prominent pediatric voice through that process, along with a couple other pediatric hospitals and health systems in our region, focused on a couple clinical algorithms in their first round of work that are specifically relevant to pediatric populations, around spirometry testing and UTI risk calculators. But that work continues, and just some really important and proud successes. And we took it as an opportunity to extend the work across our entire system beyond our Delaware Valley geography, because we really do see ourselves as one system, and it was a great opportunity to bring that subject matter, clinical expertise, and otherwise from all parts of our organization. The second is work that we've been doing really to optimize our health-related social needs screening. Nemours has a long history of really focusing on social drivers of health, and we were really excited to take an opportunity this year to look at what our screening methods and our Nemours screener, take some opportunities to get feedback from frontline staff that were using it, do some work to optimize, and then ask ourselves, what other ways across the organization are we learning about social needs, and how can we capture all of that information and report out on it and track our progress on responding? So that's been just a wonderful collaborative across our Pop Health leadership team and beyond, and really aligns with our focus on whole child health. This idea of moving beyond medicine into communities and really focusing on the whole health and well-being of the child, of their family, of the community that's really supporting and uplifting their health. And then the third, which I'm super excited about and is kind of hot off the presses, still underway in its first pilot, is something we established this past summer called the Health Equity Action Leaders, or HEAL team. And it's been a really exciting pilot initiative that I think shows a lot of promise, maybe a model for others to adopt in terms of how strategy can really align with frontline clinical leadership and those urgent imperatives that our clinical leaders are seeing and our frontline staff are seeing interacting with patients. And we're really working to tackle some disparities around flu vaccination and get creative about how we can support our staff and our clinicians' ability to just engage with families and patients, share information, build that positive relationship, because we know we are the trusted source for advice and guidance when it comes to how to keep kids healthy and safe through these winter months. So it's been a tremendous experience so far, and I'm excited to tell you a little bit more about it as we go on. But those are the three things I'm really proud of, all of which are, truly not possible without my amazing team and without tremendous, internal collaborators across our organization. And in the case of the regional coalition, external partners and just a community of experts to come together around applying what we know to improving the health of the populations that we serve.
I love those. Those are great examples. And as you think about kind of that range of work that you described, obviously that doesn't happen overnight. And so as you think about, just having the benefit of hindsight, are there leadership decisions or programmatic decisions perhaps that you would approach differently as you reflect on some of that work?
I think there's always room for improvement. I'm certainly one of those people who views myself as reflective and as kind of committed to continuous improvement, sort of that same philosophy we apply to our organizations. I try to apply to myself. I think one of the things I've learned is, I think there are times as a leader where we get really focused on the things we don't do well and how to improve them within ourselves. One of the things I've been really privileged to have access to is the opportunity to learn more about the things I do really well, to gain confidence in those things. And then in certain ways that has freed me to be less focused on convincing people that we've got the right facts, hearing from across the organization, like there's no doubt of the subject matter expertise in your leadership and those kinds of things has really freed me to focus more on relationships, to focus more on understanding what it is that different constituencies across our organization really need from us as the health equity, team that's kind of leading and guiding strategy, but that really can't achieve anything without that dissemination and uptake across the organization. So it's given me, I think what I've learned is, to get over that idea that you have to prove, that you have to constantly reprove your skills. Maybe it's something about being, a woman in leadership, or just maybe it's something about that kind of clinical training trajectory in my generation of clinicians. But to know that I'm in an organization where the subject matter expertise of me and my team is not really in question or doesn't need to be relitigated, it has really freed me and allowed me to think about how do we support our shared objectives. And then I think the other thing is that I've learned is really the message about what health equity is, that it is achieving optimal outcomes for every patient, family, and community we serve, that we want everyone to achieve their optimal health. We have this sort of tagline in our or this, quick description of our approach, which is, that health equity is the combination of population health improvement plus disparities reduction. So it doesn't put at odds like reducing disparities with improving the health of the overall population, because we're not achieving health equity if someone's health is suboptimal. Like everyone's health is optimal. And just being able to communicate that succinctly and building that has been really beneficial, and definitely something, if I could have learned to do that earlier in my tenure, I think really would have been beneficial, because it resonates and it's easy to kind of conceptualize and understand. And I think this idea of bringing in experts and leveraging external resources and partnerships and, feeding back the voices and perspectives of our stakeholders to them through assessments and engagement is something that has really served us well. And I would encourage others in similar positions, don't feel like it's just about you top down disseminating, take that time to listen. And then, oftentimes I think what we've found is what folks are saying on the ground really resonates with what we're seeing from the treetops. And yet when we communicate it back, like, hey, we listened to you first before we made these decisions, the level of enthusiasm and buy-in has been tremendous. And that, I think, our social needs screening work, that's really been one of the things that's worked well, and that I think I learned early on I needed to do more of, not be afraid of the voices or of, different perspectives from within our ranks, but really leverage that and feed that back. And I think that's also kind of the secret sauce around how HEAL has taken off so far, and why I think there's so much promise for the future.
That's great. Yeah. And I think the themes that you kind of shared in that, both in terms of how do you build the right table of collaborators internally and externally, but also thinking about how you show up at that table and ways that you kind of bring people into the conversation and into the work. I think those are lessons that health system executives of all kinds can learn from. So it's helpful to hear some of your perspectives with the benefit of hindsight. So let's talk a little bit about how you think about capacity building and the work that you do leading health equity strategy for Nemours. How are you thinking about building capacity, particularly among frontline clinicians, to address disparities in care?
Yeah, well, I love that question. And having been sort of kept myself grounded, even though I was kind of a triple threat academic before coming to Nemours, I was, doing some health system leadership. I was teaching medical students. I was doing, research, extramurally funded research. I never wanted to give up that direct connection to patients, because I felt like, number one, it grounds me in the everyday realities of children and families and of frontline clinicians who are really working sometimes through, convoluted and challenging obstacles to get patients as much of what they need from a health perspective as they possibly can. And there are a lot of barriers within the system for clinicians to be able to respond in the way they think is appropriate sometimes. And there's also just a lot of barriers in communities and in society. And we all lead complex lives that really make it sometimes challenging for families, to seamlessly access what they need in the clinical settings and outside to support the health of their children. So that kind of being just really valuing the frontline clinical experience for my own development and my own research and leadership has always been paramount to me. And when I came to Nemours, kind of did not have that same opportunity to be so grounded in the frontline clinical care provision right out of the gate, just, because that was not really the primary focus of my leadership role. So what we ended up developing, and I think it really resonates with some of the philosophies in kind of quality and safety work, and certainly equity is one of the 6 core components of quality healthcare, so a lot of alignment there, was to say, okay, we've looked at some data across certain populations, and we know we have some disparities in these areas. Maybe we did a little bit of prioritization to say, hey, we know this is something our organization is already focused on, and flu vaccine is a great example. It's something that really matters for a lot of our particularly medically complex or children with certain chronic diseases. We know it has impacts on our sort of external evaluators in terms of how they rank us from a quality perspective or otherwise. For some groups within our organization, it may have impact on their value proposition. It could be one of those value-based measures that they're held accountable for performance around that we really want to optimize. And certainly for patients, it has a huge amount of impact potentially for certain patient subpopulations, that they need to have that access. And so we looked at where we maybe had some disparities. We did some partnership in 2023 with some of our primary care sites around ways they might expand vaccination. And then we said, we'd love to do something that aligns with our specialty care efforts and other efforts across the enterprise during flu season, but that maybe adds an extra layer that might help reduce some barriers for certain subpopulations or really empower clinicians to engage in those conversations, even if it, there are different perspectives on whether vaccination is needed. So we put out a call in the summer in June saying we wanted to try an inaugural cohort of health equity leaders. They needed to be frontline clinical folks. They needed to be leading clinical teams, folks who could think through the clinical operational barriers to flu vaccination in different sites of service, who had leadership buy-in in their areas. And we got this amazing cadre. I mean, first of all, I was hoping for, a handful of applications. We wanted to have all of our geographies, North Florida, Central Florida, Delaware Valley represented. We got like 20 applications for somewhere around four to 6 spots. So it was really hard to identify the folks that we were going to have start this. But what's been so amazing is that those folks came together, and whether it was like Pensacola or Orlando or Wilmington, we heard a lot of recurring themes in terms of the types of things that the frontline teams really wanted to augment or support beyond the yearly flu blitz efforts that are pretty ubiquitous. And so they identified some extra layers they wanted to add. A lot of it was around, some patient-friendly education, some things to just open the door to the conversation, some ways to kind of encourage people to take a systematic approach to that, and some endorsement from leadership to say, hey, we want you to do this. And then we also focused in on some special populations like kids who are coming in for procedures under anesthesia or sedated imaging, and thought, this is a great way to remove barriers for a subset of children who may have a lot of exposure to the healthcare system, may have some, anxieties about vaccination or needles in general, or may have developmental needs that make it difficult in primary care settings to really serve them optimally when it comes to vaccination without, trauma to them, trauma to their family. And so thought that was really innovative, and also spoke to equity in terms of subpopulations with specific needs that we need to be responsive to. And we've got nursing, social work, physicians, all represented, inpatient, outpatient, among the 6 folks involved, from Pensacola to Jacksonville to Orlando and Delaware Valley. So already we're seeing enthusiasm about spreading some of the interventions to other sites across our system. We've seen really high uptake of the vaccines based on prior year, assessments of how much to order, and are really excited at the level of community and empowerment this has, and sort of normalization of some of the challenges across different subpopulations that this has given the clinical leaders involved. And we wanted to value the level of effort they were putting in. So, it's not just discretionary. This is like an investment we're making for the year in these pilots. We're building out some dashboarding to look at the impacts compared to prior year, and really thinking about how we could use this to address other things, like maybe our social needs screening and response in the future, or other key areas where we see disparities or a particular need to attend to certain subpopulations or settings. And, I've taken on meeting with each HEAL team leader one-on-one, and they're always thanking me for the opportunity. And I'm like, are you kidding me? This makes me feel close to the patients. It's so exciting to be able to empower the folks who are there every day showing up for our patients. And then, we have this great opportunity to turn that into data that we can learn from as a system, and that we can feed back to them to get their insights about how, the data we see in the abstract really relates to what's happening on the front lines and in the setting. So, hopefully we'll have a lot more to say once we're through this pilot year. We're really excited to disseminate and share more as it evolves. But the early signals from my standpoint are really exciting. And again, this is a partnership, leadership from my team. We've got leadership and support from our program management and strategy team, and certainly the buy-in and support of all of the supervisors, of the frontline clinical leaders who are a part of this pilot program. So really exciting, I think.
That's really exciting. And I like what you described about the two-way nature of, there's a lot that this brings to your clinical team, your frontline clinical leaders, but then there's also a lot that it offers to leadership in terms of context, in terms of, that proximity to what, each of your leaders are navigating across your markets. And so I think that's a good reminder for folks who sit in the executive seats to say, hey, we got to make sure that we're having those conversations with our teams regularly across the board. So maybe we'll
the one thing I would add on that, Jasmine, is it's amazing to me the difference between what we think the workflows are and what happens in reality. And the more that we can normalize the need to have those bidirectional conversations so that we actually understand, how things manifest in clinical environments. Having been in those environments and personally had to navigate through those complexities, it's a great reminder to that need to kind of validate, to revisit without stigma or without judgment, but just say, hey, is what we thought we were going to do really how this is taking place, or what's different, and how do we optimize our ability to capture that data too?
Yep. And the leadership skill, I think, of learning and changing your mind perhaps around opportunities for improvement. I think that's always a good reminder. So maybe you can talk about, one of the other parts of your role, which is collaborating with the executive team at Nemours. How are you thinking about that partnership and collaboration to ensure that the work cascades across the organization?
Absolutely. Well, I have the privilege of reporting to our Executive Vice President, Chief Population Health Officer, who's a key member of the executive team, and am really excited not only by her leadership and vision for whole child health and for the work that we continue to do to move well beyond medicine into communities to support healthy conditions for kids, but also to partner with her colleagues across the organization. The HEAL team is another great example where, I really did reach out to the executive team and say, hey, can you help us encourage folks, help us publicize this? I think we've done some other work really focused on building that environment within the workplace that supports people being inclusive, speaking up, making room for those different perspectives. And that's a place where, I think our executive vice president, chief nursing officer has been another really important partner whose teams have really encouraged and taken on a lot of partnership with us. So the fact that I am encouraged by my leader to connect with other members of other of her peers has meant, when we're looking at social needs screening and our reporting and what other questions are being asked, the CNO connects me with her downline and tells me who's really working on what key initiatives. And it's just engendered such a tremendous level of partnership amongst, regional executives and system-wide executives. Another really important set of collaborations has been with our chief quality and safety officer, and jointly through the executive leaders that are accountable for quality and safety and pop health, have had these opportunities to present our work as part of our quality and safety reports to the board, really create that visibility, create that alignment. And frankly, I'm an academic by background. I feel like teaching is just sort of what I've always done professionally. And there is a certain kind of way of communicating this information that doesn't assume everyone's starting from the same place, but that respects their knowledge and seniority and leadership. And I think that's the way we've approached our engagements with, in communication to the board and communication to the executive team. But I would say particularly with our physician and nursing executive leaders, that's been a place of real close partnership. And I'm excited to see what other partnerships with, others in the operations downline will have the opportunity to engage in the future.
And it's not an afterthought, I think is what I hear you saying, because a lot of folks, when we have conversations about health equity, will say, oh, we'll figure out XYZ priority, and then we'll think about the equity lens that may be applied to that work. And I think the leadership that you all have shown at Nemours is really how deeply integrated it is across the organization and all of the work that you do. So I think that's, a good example and role model to share with others. So I know we're coming close.
That's a testament to like other leaders, who pull me into data governance, pull my team into AI governance, like all these, like that's the fact that others are thinking of us. And we're not just beating on doors, but they really see those connections. I 100% agree with that.
Well, I know we could probably talk all day about this. I'll have one final wrap-up question for you as you think about heading into 2025. We're recording this towards the tail end of the year. What leadership skills do you view as most critical to advancing health equity in 2025?
I think building relationships and communication are top of mind for me. But having done some, having had the privilege to do some like reflective work this year on my own leadership journey, personally, I'm leaning into optimism and I'm leaning into this idea of possibility. And there are many intractable obstacles in healthcare, like so many hard problems we've been trying to solve for a really long time. And I am sort of, my commitment to myself, to my team, to my organization is to maintain that sense of optimism and possibility that there are a lot of things that we can do in the interest of serving our patients and the families that support those patients and the communities where they hopefully can thrive. And, so I think philosophically a focus on optimism and possibility, just because I know I'm wired to sort of think through all the downsides and guard against every risk. And then from a skills and approach, I think it's about effective communication and building relationships so that we can advance things that really do resonate with a set of shared priorities. So, we'll stay the course, and I think we will always hold ourselves accountable to do our best to be focused on, the impact this work is having on the children and the families and the communities that we serve, because that's why we do what we do every day.
Perfect place to end. Rachel, thank you for your leadership, for your expertise, and we'll see everybody next time on the Health System CXO podcast.
Thanks, Jasmine.
Thank you for joining me on the Health System CXO podcast, where we activate health system leaders towards outcomes and scalable solutions you can implement now. Remember to subscribe to the Health System CXO podcast on your favorite podcast platform so you never miss an opportunity for insights. If you like this episode, consider leaving us a review and sharing our podcast with your friends and colleagues. You can also connect with us on LinkedIn by clicking the link in the episode description. See you next time.